Where we live, work and play has a big impact on our health and well-being, and this can vary greatly depending on where people are born and brought up. Our reporter met with RSPH Chief Executive Shirley Cramer for this exclusive interview.
The programme this year is called A Place for the Public's Health. How important is place?
Place is extraordinarily important for the public's health and well-being. And we know this because the evidence is very clear that if you live in an area of disadvantage, so a place that has poorer housing and not such good retail and probably less green space and poorer schools, and all of those things affect your health and well-being. So where we live, where we work, where we play will really make a significant difference overall to our health and well-being. And the evidence is very clear that here in the UK and abroad that there are vast health inequalities. And so place, if we can do something to improve place, we can really make a difference.
Social media is portrayed as the devil sometimes, but you're taking a very close look at it, aren't you?
We became concerned last year when we started looking at the evidence base around mental health in young people and the use of social media. So we decided to ask young people, so tell us about your health and well-being in relation to social media. So we produced a report called #Status of Mind, which highlighted the negative and positive impacts. We've now this year started an all-party parliamentary group on social media and young people's mental health, and that's been really good because loads of MPs are very keen to be part of the discussion.
Do you think the government's doing enough to address inequalities?
I would say broadly, overall, no. And the reason for this is partly that they're quite embedded in, over years of austerity. What that's meant is that sort of increased the inequalities. And we know this from Sir Michael Marmot's work at the Institute of Health Equity. So we can see these disparities. And of course, that has a massive effect, we found, on health and well-being. Depression, anxiety, family relationships, and even things like smoking and drinking, classic public health issues. If you do drink, you might drink more. If you smoke, you might smoke more because you're in this, you're having mental health problems. So these are really important issues in place.
We have a wider healthcare community now, gyms, opticians. How important are they?
The Royal Society for Public Health has been the leading champion for what we've called the wider workforce for the public's health. And the reason we think it's so important is that prevention is, in a sense, everybody's business, or everybody who's, in a professional sense, working with other people. There are 40,000 people who are public health professionals in England, but loads more professionals who want to be involved. So we've worked with the fire service, housing, and many others. This year, we worked with UK Active and produced a report looking at gym professionals and exercise professionals and their role in health and well-being. And what's really interesting is how enthusiastic they are to be part of the wider workforce for the public's health, promoting healthy conversations and signposting to support if people need it, and to be thought of as part of this wider group of people who's really helping to prevent ill health.
Well, how do you see the future?
I see the future in two ways. If we're really serious about improving the public's health as a society, we're really going to have to equalise place. We're going to have to make all places as good as the best, all schools as good as the best. We're going to have to really invest in early years, which is where it matters, really invest in schools. And we're going to have to be knowledgeable about what's good for us in our health and well-being, not in a don't do that because it's bad for you, but in a sense where we have a chance to discuss and think about things like social media. How are we going to manage it for ourselves and our children so that we can take a bit of control about our own health and well-being, with the state taking its what it needs to do in terms of bringing up place, the base and our public institutions that will really equalise our life chances.